Good evening, everyone present here. Good evening, Sangshaptak Saha. Actually, sir, apologies for the because of the delay. We were having a mock examination. That's why we got delayed. So we'll be starting, sir.
Yeah, we shall be
Yeah,
starting.
yeah, please. So good evening, everyone. The debriefing session will be taken by Dr. Sangshaptak Saha, sir.
Good evening. So today's session is a debriefing session of the neurology mock exam that we had. So first we shall be discussing the long test and then we shall be discussing the imagings. So since it's a debriefing of, I think I am audible, right? So since it's a debriefing session for the EDIC part 2, so I have added some slides with the answers that it was expected out of those who took the mock test. I think there were 4 candidates who took the mock tests. And if you had answered those 4 points, then you would have got the marks in the exams. Anything else which may have been right otherwise, even if you have told and those points were not included in the answer and the points which were to be answered you missed, then you would have missed the marks. That's how it will be in the real exam also. Like, for example, before we start the session, the management of subarachnoid hemorrhage, I had mentioned around, I think, 4 to 5 points. So if you have covered those 4 to 5 points, then you would have got the full marks. If you have covered the 3 points out of 4, you would have got 1 marks less. But if you have not covered 2 points and you have told 3 points extra, which 3 points were not in the answers that I had told, or in the actual exam, the examiner would have written down in the mark sheet, then you would have not got the marks. So you would have got 2 out of 4, 2 out of 5 for that also. So here I have not given the marks because it's only a debrief session. But once you have a look at the answers, I think you will know that what was expected. Okay, so this was the case. So now let's break it down. So it's a 62 years old male patient who's a known diabetic, which is poorly controlled, and he has got a history of peripheral vascular disease, who has come to the hospital with a history of unresponsiveness at 9 p.m. and was last found well at around 7 p.m. So as we know, as we all must be knowing, so last found was at 7 p.m. right? He started responding after 2 minutes and was found to be irrelevant talk. So this from 7 p.m. is the last known good GCS, right? This is important because in the actual exam they can here see, because it was a case of subarachnoid hemorrhage, so it was not very important. But if it was a case of a ischemic stroke, then this would have become very important, because then they would have definitely given you a time frame like it's now 9:30 p.m. So then you would have to calculate that it's 2.5 hours. So accordingly, we needed to perform. In subarachnoid hemorrhage, this timing is not very important, and I mean not that important. So I have not given the time when he came to the hospital. Okay. So now his GCS is 12, right? He has a 12 GCS. Pupils are bilaterally equal and reacting to light. He is moving all 4 limbs. Neck stiffness present. One of the candidates in the DT is told that meningitis is one of the differential diagnoses. I'm afraid, but I mean, if you tell meningitis is a DT of this case, you won't be getting the marks, okay? Because meningitis 100% will not be one of the DTs here. Okay. So, and his vitals has been given, sugar has been given, very important for a neuro case, and he's like not requiring any oxygen. And we have done a CT scan of the head. Again, during answering, when I asked about the management, one of the candidates told that he or she will do a CT scan of the head. So, you are already seeing the CT scan of the head. So if you again tell that I shall do a CT scan of the head, and it will be like you're wanting to repeat a CT scan of the head, then the question will arise, why do you want to repeat a CT scan of the head? Then you'll be like, no, it's not, I don't want to repeat, I forgot or something like that. I just told it because, so don't tell that. Okay. You won't be able to come out of that situation, right? If you tell a CT scan of the head as a, what will you do when already a CT scan has been given? So always reply to what scenario has been given to you. It's not, they do not want to know how much you know about subarachnoid hemorrhage. They want to know how we will treat this patient with subarachnoid hemorrhage. And the patient had the sinus arrhythmia. I shall I shall tell you why sinus arrhythmia present was important here. I think most of you guys missed it or forgot about it later. And the hemoglobin is 7, and some values have been given. Okay, so sodium has been given as 130, potassium has been given as 4.5. Later we had a question, right, on dyslipidemia also. So important to remember that. So one of the common questions that I am asked in some other mock tests that I also take is that how much to write during those given 20 minutes before the questions start. So the parts which are marked down, which I marked. So if I was giving the exam, I would have marked that the age, the comorbidities, poorly controlled perivascular disease, the timings. Because now at this point of time, I do not know whether it will be severe or ischemic stroke or not, right? So I have to mark down the time. Then the GCS, neck stiffness, and the blood glucose, and a CT scan has been done. And these findings, the arrhythmia, the hemoglobin is low, sodium potassium value, this. So hemoglobin is low here. I don't think anybody remembered this, but we shall be discussing it as we proceed also. But in one of the vignettes, there was a case of a, you are telling a rebleed, right? Everybody was telling the DD of a rebleed. So if it is a rebleed and the hemoglobin already is 7, so you need to transfuse the blood later on, because definitely the hemoglobin has gone below 7. That is the point of giving the hemoglobin 7. And the actual exam also, they will give these values. They will not ask you directly that when you transfuse the blood, but they will give these values, and then they will give a scenario where you have to apply them. Okay. Now about this CT scan. So almost everybody told that this is the case of subarachnoid hemorrhage, which is, I mean, pretty obvious. But what I wanted to tell you was that only telling the subarachnoid hemorrhage in a EDIC part 2 will not be enough, especially in this case where there is nothing much else, right? So you also have to tell which cisterns are involved, like a supracellular cisterns are involved, or the lateral cisterns are involved. Here you can see this part is involved. So this is a supracellular cistern. This is involved. So this is a lateral cistern, right? So these things you have to tell. You just open the Google, you search the images about the cisterns of the brain, and you will know which cisterns are involved in this particular subarachnoid hemorrhage, whichever will be given in the exam. So what is important to remember from this subarachnoid hemorrhage and where exactly it is located, which cisterns are located involved, that you need to tell. Okay. Sorry. So describe the city involved, that will be that one only. SH in supracellular cistern and some loss of gray white matter differentiation, which was again told by everybody. You see, especially in this city, there is loss of gray white matter differentiation, right? Because it's an extensive subarachnoid hemorrhage. You can see this one. Then in this part, there is another involvement. This part also. So it's not a localized subarachnoid hemorrhage. Almost all the systems, in the lateral system, supracellular system, have this, and they definitely loss of gray white matter differentiation. And as somebody told, there is also some hematoma in this region that you can tell. Even if you miss, it's okay.